Hello, my name is Dr. Andre Jones with Inspire Dental, and today we're going to talk about dental examinations. So, a question many people ask themselves are dental examinations and cleanings really that essential? And they are. A dental exam is more than just, poking and prodding and just counting your teeth. When we're doing an examination, we're checking and examining your mouth for oral cancer, infections, things that can go missed and then turn into really big problems later. And what's so tricky about, infections and cavities and things like that in the mouth is most people think like, well, obviously it's going to hurt if it's there. And in most situations, it doesn't. Just the way our body and nerves are in our mouth, it oftentimes things don't hurt until they become really big, and then they require extensive, expensive treatment. So an examination is essential to help us make sure that we are preventing or catching things at an early time and not allowing them to grow to much bigger things. And ultimately, it's to keep you healthy. We want to make sure that you are at your greatest health and vitality. The mouth is the gateway to the body, and so we really want to make sure that your gateway is clear and clean. So what's normally included in a dental examination is usually x-rays, a oral cancer screening. We do a gum assessment. We also look at your teeth. We also will do scans of your teeth, of your bite. Those are all things that are included into a dental examination because we want to make sure that everything is clean, healthy, and balanced within your bite. That way we can create a preventative plan for you, and so that way we're not just maintaining problems, but preventing problems from even occurring. The question that people often wonder, even though we've been to the dentist, we could go to the dentist our whole life. People wonder, like, what is the dentist like really looking for? And like I said, we're just looking to make sure that things are healthy. We know what healthy looks like, and so since we know what healthy looks like, you can easily spot what's not healthy. And so, well, what are some things that would be considered not healthy in your mouth? Um, One being oral cancer. Oral cancer, it is very treatable when you catch it small. But when it grows and becomes, bigger, well then it can be medically and life threatening. And so and you don't have to be a smoker. Most people think, oh, well, I have to smoke or something, or do drugs to be at risk for oral cancer. You don't. I mean, um, many people who get oral cancer never did any of those things. And so that's why we're always checking. We're also, part of that too is we're not just checking in your mouth, I'm checking around your mouth. I'm feeling the joint, I'm feeling underneath your chin, your cheeks, and then we're looking at the neck, inside the throat. We're checking all of those things. These are areas that most physicians don't look at. And so we're checking them to make sure that, one, you don't have cancer, you're healthy, you're cleared there. And then we do a gum assessment. Gum disease is one of the most prevailing problems in America. About 2/3 of America has gum disease. Well, people who have gum disease tend to live 7 years less than the average person. So it's like, oh my gosh, well, if it takes off 7 years off your life, well then, yeah, we need to make sure we treat that, that you don't have that. And so we also do a gum assessment to make sure there's not any progressing, disease there, because gum disease as well, like I mentioned, most oral types of diseases are painless. They don't hurt until they become really, really bad. And then at that point, it's too late for you. And so that's another thing that we check. And then, like I said, we make our way. We check believe it or not, we actually check the teeth last. And then we verify and make sure that the teeth are in a good, healthy state. So once you had your dental exam, things that we'll typically recommend are going to be like, a electric toothbrush versus a manual. We're gonna recommend different types of toothpaste that are more that better repair your teeth. Different types of floss, maybe even a water type, flosser like a water pick. Those are very common things that we'll typically recommend after a cleaning, just because they are scientifically proven to be better than toothbrush or the traditional type of flossing. And so we always want to make sure that we're providing our patients the best product. That way they can have the best health and best maintain, because if they can better maintain themselves, that means it's going to be less work that they'll need dental wise. And other things that we're going to recommend, depending on what we see as far as disease, are going to be, treatment to handle the problem. But like I mentioned, what is very important and something I'm very passionate about in my practice is that we don't just handle your problems. but that we also create a preventive plan for future problems. So every single time we're going to be we're going to be teaching and giving education to make sure that we are creating a preventative plan as well as a immediate action plan on taking care of your needs. So there's going to be some of the things that we tend to recommend following a dental examination. So there are different types of dental exams in my practice. If you are coming in because you have an immediate toothache, or if you are a new patient to my practice, or you've been coming to my practice and now you're just due for your biannual exam. And so so they all take a different amount of time. Usually if it's an emergency, it takes about an hour. If it's your biannual exam, that's going to take about an hour or about 10-15 minutes. And then if you're a new patient to my practice, it's going to probably be an hour and a half to maybe even 2 hours, depending on how much need you have. And we might even need to do a follow-up consult, depending on, again, what extensive needs you have. What's important for me is that we don't just rush through the exam process, that we take our time, we address all your concerns, all your needs. Like I said, if we need extra time to do that, to help educate you and get you on board with how we're going to maintain and prevent these things, I am happy to schedule additional time in a consult. I don't charge for it. And that way we can sit together and really make sure you are confident in what steps and actions need to be taken moving forward. Dentistry is not fun for most, and I know that. And so a question I get often asked is like, is my dental exam going to be painful? And no, it's not. This is this is where we want to make sure that you are comfortable, all your concerns are addressed. And so your comfort is one of our top priorities and concerns that we want to make sure we address. And so I know we can have bad experience of the past, and that gives us fear to move forward, in the future. And so, so the dental exam is where we're just getting to know each other, and we're just stepping into this. We're not going to do anything that is going to make you feel uncomfortable. We're learning your preferences, and we are customizing our approach to you. And so that examination is really a kind of a, like I said, we're going to ease into things. We are not going to do anything remotely painful at all. And if you're requiring treatment that could be painful, well, then we have options to handle that anxiety, handle that pain. That way it is a comfortable process for you. Thank you for your attention. I hope that this video addressing what are dental examinations and what it involves was helpful to you. If you have any questions, feel free to give our office a call at 210-734-5092. You can also look us up on our website. It's inspiredentalsa.com. There'll be links available to you. That way you can also check us out on our website, request an appointment through there as well. We look forward to speaking with you and helping you with your needs. This is Dr. Jones signing out.